Does tirzepatide make you feel angry or irritable? If you're on Mounjaro or Zepbound, you might be wondering the same thing. And it's a fair question, because mood changes can affect your relationships, your quality of life, and your willingness to stay on treatment. So let's walk through what the evidence actually says. Tirzepatide works on two receptors, GIP and GLP-1, to help control blood sugar and reduce appetite. It enhances insulin secretion in a glucose-dependent manner, suppresses glucagon, and slows gastric emptying. It's FDA approved as Mounjaro for type 2 diabetes and as Zepbound for chronic weight management. Now, here's the honest answer on anger and irritability. Tirzepatide is not documented to directly cause anger. The Mounjaro prescribing label does not list anger or irritability as recognized side effects. The Zepbound label, however, does include a warning for providers to monitor patients for mood changes, depression, and suicidal thoughts or behaviors. So the picture isn't completely clear-cut, and it does vary depending on which formulation you're taking and why. It's also worth knowing that regulators are evaluating reports of suicidal thoughts with GLP-1 medicines as a class, but a causal link hasn't been established. Clinical trials for tirzepatide primarily documented gastrointestinal side effects. Mood symptoms weren't a major finding, though that doesn't mean they can't occur in real-world use. So why do some people report feeling irritable or emotionally off? There are a few indirect factors worth understanding. First, low blood sugar. Tirzepatide enhances insulin secretion, and if blood sugar dips too low, especially in people also taking other diabetes medications, that can cause irritability, anxiety, and mood shifts. That's a well-known effect of hypoglycemia, not necessarily the drug itself. Second, gastrointestinal side effects. Nausea, discomfort, and fatigue are common, especially early in treatment. Feeling physically unwell for extended periods can absolutely affect your mood. Third, reduced calorie intake. Tirzepatide can reduce appetite, which may lower calorie intake. If nutritional balance isn't being maintained, that can sometimes contribute to low energy and irritability. And fourth, the broader emotional weight of managing a chronic condition, adjusting to a new medication, changing your relationship with food, that's real and it's worth acknowledging. So what should you do with this? A few things worth discussing with your healthcare professional. If you've noticed mood changes since starting tirzepatide or after a dose adjustment, bring that up at your next appointment. Don't try to diagnose the cause on your own. Your provider can help figure out whether it's related to the medication, blood sugar fluctuations, dietary changes, or something else. And importantly, don't stop or change your dose without talking to your prescriber first. If you're on other medications that affect blood sugar, ask whether hypoglycemia could be contributing. Keeping track of when mood changes happen and whether they coincide with meals, doses, or specific times of day can give your provider really useful information. Now, when should you reach out right away? If you experience persistent mood changes that don't resolve, feelings of depression, or any thoughts of self-harm or suicide, contact your healthcare provider immediately. Don't wait for your next scheduled appointment. If you're in crisis, you can call or text 988, which is the suicide and crisis lifeline in the U.S. Also seek prompt attention for signs of pancreatitis, severe abdominal pain that may radiate to your back, or any symptoms of an allergic reaction. Let's recap. Tirzepatide is not documented to directly cause anger, but the Zepbound label does warn providers to monitor for mood changes and depression. Indirect factors like low blood sugar, GI discomfort, and reduced calorie intake may contribute to irritability in some people, and those are worth exploring with your provider. And if you experience persistent mood changes, depression, or any thoughts of self-harm, reach out to your healthcare professional right away. Nothing in this video is a substitute for personal medical advice. Your doctor knows your full health picture, and they're the right person to guide your treatment. Have you noticed any mood changes on tirzepatide? Drop a comment below. Your experience might help someone else feel less alone. And if you found this useful, give it a like and subscribe so you don't miss what we cover next.